This is probably one of the most difficult areas, I think, in medicine, because lymphoma is so different to many of the other cancerous disorders that we look after. So we spend a lot of time trying to help people understand the process of diagnosis, the process of treatment, and the likely future. So I suppose the first thing I'd say is that time's necessary. And for people watching this DVD, probably the most important message is that they need to make sure that they're comfortable in having those discussions with their healthcare providers. Very important that what you hear from me is broad concepts. What you need to do is make sure you're hearing it, understanding it, and are satisfied with your explanation, with the explanations that you're getting from your healthcare providers. And healthcare providers are going to be doctors, nurses, the various helplines, the whole spectrum of things. So the concepts start off with understanding that lymphoma is a cancerous disorder, but many people don't actually know what cancer is. And so we often have to talk a little bit about what cancer actually means. And the way I explain that is that most of the cancers that develop in various organs in the body are based on the following idea, that a normal cell, which has a normal role in the organ that it's sitting in, becomes abnormal, so that it's no longer performing the normal role, and in fact all it's doing is multiplying, and in time doing lots of things that it would normally not have been destined to do. Now that concept is relatively simple when you're thinking about a disease like breast cancer. The abnormal cells in breast cancer develop in the breast. The normal role of breast cells is relatively limited. The same thing in bowel cancer, the same thing in brain cancer, if you like. Relatively simple roles. And what happens in that sort of cancer is the cell becomes abnormal, so it doesn't do the normal thing. All it does is starts to multiply, a lump develops, that leads to the diagnosis, and then as the disease progresses, various of those cells that have developed in that lump break off and go to other parts of the body. But lymphoma is very different, and the reason it's different is it's a disease of cells called lymphocytes, and this is where the analogy starts. And the analogy I use with my patients is it's a bit like going back to the Wild West and picturing forts and battles. So picture the immune system as being these cells called lymphocytes. So these are the cells that become abnormal in lymphoma. But let's picture for a minute what they do normally. So picture the Wild West. You've got your forts that are defending from invaders. So picture the body as being defended, and the things that are doing the defence are the forts. And these forts are full of lymphocytes. They're the soldiers. That's one component of the process. And what happens is that there are they send out little parties to go and find the invaders, and we don't need to talk about which particular invaders we're talking about, but you can picture it. So they go out and they find the invader, bring the invader back to the fort, or there might be other scouts out there that are out there all the time, bring the invader back to the fort, recognise that this is an invader, and then in the response that's required to deal with the problem, they basically increase the numbers. And what happens in our body is the number of lymphocytes dramatically increases in numbers. And then they do a variety of things that kill the invader, might go out and make sure the invader's gone from everywhere else. And then when the war's finished, they all die off and just leave some to fight another day. So that's how it works normally. So there are a few things there, a few really important concepts. That's very different to the breast cell or the brain cell or the bowel cell, where the cell has just sits in one place, does a few relatively simple things, doesn't circulate around the body normally, and when it becomes abnormal, it just basically makes a lump until that lump gets huge and cells have broken off and gone to other places. Lymphocytes spend their life circulating around the body. They spend time in the lymph glands, they spend time in the blood, they spend time in the bone marrow. So they're always all over the place, and they need to be, because that's the job they're doing. They're out there finding these problems, coming back to the fort, dealing with it. And that's one of the reasons that lymphoma is a disease that often is in multiple places when it's first diagnosed. The other important concept that this introduces is that not only is it often in multiple places, but because there are so many different members of this army, lymphoma is not one disease entity, it's a whole spectrum of different diseases, because the different soldiers were off doing their job and then they suddenly became abnormal and are just multiplying. But they had a job to do, and that's why the disease ends up being very different for one sort of lymphoma versus another. So that conceptual understanding, I think, helps some people understand a few concepts. It helps them understand where the diseases come from, why it's in multiple places, and also introduces the idea of why your lymphoma is not necessarily going to be the same disease, same process as somebody else's lymphoma. But more importantly, your lymphoma is very different disease process. It might be a cancerous disorder, but it's very different to somebody with breast cancer, bowel cancer. So going back to my analogy, the fort's full of people doing different jobs, and there are different sorts of forts that do very different jobs. So the lymphoma, due to an abnormality in that sort of lymphocyte, will end up being very different to the lymphoma due to a different sort of lymphocyte, or it can be. So some of our classifications are based on the different sorts of lymphocytes, and you might have heard people talk about T-cell lymphomas versus B-cell lymphomas. Does that matter? Well, it matters because it might affect the treatment, but it's more for us to understand as the healthcare providers so that we can tease out what we believe is the best treatment. The other classification, or the other way we think about lymphoma, is in terms of you might have heard expressions about low grade or indolent versus intermediate or high grade, which talks more about the behaviour of the lymphoma. Some lymphomas develop slowly, and one example of this is a form of lymphoma called follicular lymphoma. Develops slowly, responds to treatment, goes away for a period of time, goes away in terms of not causing any trouble, but there are still abnormal lymphoma cells in the patient's body, then comes back, and that process might occur multiple times through the patient's life. Other forms of lymphoma, the more so-called high grade, can make you very crook very quickly and requires different sorts of treatments. So there are a number of different ways of thinking about that very long list. What's important for you as a patient and what's important for us is that we come to an understanding about the sort of disease it is in terms of, on that long list, in terms of the treatment you require and the likelihood of success of that treatment. And that's the important thing to be asking your healthcare provider.